restraints and field anesthesia. Now, we do induce general anesthesia periodically, and most of the time when we do general anesthesia is for castrations or something like that. We're going to do a surgical procedure, but one that's very amenable to doing in farm settings. If we're going to completely anesthetize the animal, we've got to make sure that the animal is prepared for the general anesthetic, because this is going to be a much more intense procedure, and we don't want them bloating and eructating and getting aspiration pneumonia and all those sorts of things. And so we've got to make sure that we can put the head in a more aggressive downward position than we do just with the sedation. And so we're going to tilt that head more aggressively. And we've got to have that animal prepared by holding it off feed, which I'll talk more about in a minute, so that we have a lower risk of bloat and regurgitation. And then ultimately, we need to consider whether we should be prepared for endotracheal intubation, because if we get that animal too deep, too fast, and its airway becomes compromised, there's no time to drive back to the clinic and get a tube and bring it out. And so we need to probably have a kit available that we could intubate them if we needed to. And so we tend to put these guys in a fairly aggressive head-down posture. This is one that's on a foam pad, but you can use straw bales and things like that to establish that head-down posture. Basically what we're doing is we're keeping saliva draining away from the larynx, and we're also keeping any fluids that may get eruptated draining away from the larynx. As long as they're not in that position too terribly long, you know, it's pretty safe to do that and gives them a better airway protection. I'll show you a technique for endotracheal intubation. We get calls about this as, you know, how do you put a trach tube in a camelid? They are challenging because they have, you know, that long mouth that you can't open very wide. You know, they're not a dog. And so what we do is we have an extra long laryngoscope blade, and so this is the longest normal blade. You get these extended blades out, and that's, you know, 20 plus centimeters long. And that way we can feed that all the way back into the back of the mouth so that we can see that larynx very easily. And then we have these long tubes, and so this is a foal tracheal tube, and so it's designed for the horse, and so it's quite long. And then we have this long catheter that we can place through the center of that tube so we can make it rigid, because this hole is pretty far back in their mouth. So we need to be able to see with that extra long blade of the laryngoscope. We need to have a long tube so that we can reach the trachea. We need to have a long stylet so we can keep that tube rigid while we're putting it in the trachea. And then we need to have something to tie the tube to the jaw. And so once we get that tube placed, we're going to tie it off in place. And so this is an alpaca that's been anesthetized. She's sitting in sternal recumbency. We've got her propped up against the bale there. We're going to extend this head and neck up so that the nose and the neck are in a straight line. And so we're going to hyperextend that head to try to open up that airway as much as we can. And then this is that long laryngoscope blade here looking all the way down. And what we do with that blade is we get it in the back of the mouth and we push the soft palate up so that it exposes the larynx. And then we'll deflect the epiglottis down so that we can see the arytenoids. And so these are the arytenoid cartilages in here. And we're looking straight into the trachea. And so by doing that, we have an open path right into the trachea, and so it's relatively easy to pass that tube. And so you can see how long these things are, you know, relative to people. So that's a long tube going down this stylet. We're going to feed that right into the trachea. Once that tube gets into the trachea, we'll pull the stylet out and tie it to the mandible so that it's secured. And so if we feel like we're going to do something that really demands protecting the airway, this is how we do it. You know, nothing in there is particularly expensive. It's just specialized equipment, and so something that you'd have to consciously go get. Other things that we think about when we're doing general anesthesia is how long the procedure is going to be. Are we going to do an intravenous or an intramuscular technique? And realizing that when we do that intramuscularly, as with the sedation, that the efficacy of those drugs varies from patient to patient. And so we tend to use the butorphanol, xylazine, ketamine combination at anesthetic dosages because that has proven the most reliable for us. And so, you know, we want to be careful about those dosages, and we want to maintain patient safety. And so the cocktail that I use almost to exclusion, it's very rare for me to use something else and when I'm doing a field anesthesia, is butorphanol, xylazine, and ketamine. And you'll hear people call this BKX, but I like to think of it as BXK because it's increasing dosages. And so when I tell you the dosage is just BXK, you'll hear people call it BKX. The butorphanol, xylazine, ketamine, it does have some variability in the consistency of effect. I think a lot of that has to do, if you're giving it intramuscularly, do you get all of it in the muscle? And some of it certainly has to do with patient attitude. These guys should be held off feed a minimum of 12 hours overnight. If we know we're gonna castrate tomorrow, we pull them in, we take them off food. When we say to hold an animal off food, it means all feed material. A lot of times when we tell owners to hold them off feed, then they don't give them grain, but they've got all the hay and grass they want. When we hold them off feed, we want them held off all food materials because the grass and the hay contribute to bloat and fermentation and digestion just as much as anything else. The grain produces more gas and acid, but all the other processes are still there. And so all feed. We want to have a quiet environment. The last thing we want to do is be chasing this animal around the pasture for 30 minutes before we're going to give them an anesthetic. And so, they need to be caught up in a quiet environment so that those drugs will be more consistent and reliable. And then we need to have sufficient help. The worst thing to do is try to do something by yourself and you really don't have enough hands. So the BXK cocktail that we make for field use is we take a 1 gram bottle of ketamine and we add 1 ml of the large animal xylazine. So we add 100 milligrams of xylazine into that bottle. And then we add 1 ml of the 10 milligrams of butorphanol into that bottle. And so that cocktail right there allows us to dose based on an approximation of body weight. We need to have a pretty good idea of what they weigh. It's very common. One of the games we like to play with our students is you get a alpaca out that's a nice big acaya. It's got a full year of hair growth on it. Say, how much does that animal weigh? 240 pounds. It was about 120 pounds of something under that fiber. And we don't dose for fiber, we dose for muscle. And so having a pretty good idea of what those animals weigh is important, whether you're using a weigh scale or a weigh tape or whatever. That cocktail allows us to dose alpacas at about 1 ml per 40 pounds and llamas at about 1 ml per 50 pounds. We will increase the amount of drug for males, 0.5 ml for alpacas and 1 ml for llamas. We will also increase for surreys. And so if it's a female surrey, we'll add 0.5 ml on it because she's a surrey, on those things. And that gives us a very consistent surgical type anesthesia for about 1/2 hour. We expect those animals after an intramuscular injection to lay down. So that dosage and whatnot is intramuscular. We expect them to lay down in 3 to 8 minutes. And so it's pretty quick and in onset. And so if you wanted to actually dissect that dosing regime out, you can set that on a milligram per kilogram basis so that you don't have to mix up a whole bottle of it. But the BXK cocktail bottles, if we keep that in a cool, dark environment, we've kept that around for easily a month at a time, oftentimes longer than that, and still had pretty good efficacy for it. So all of those products are types of acids, and so they don't neutralize each other very quickly. And so if we mix up a bottle of BKX, we usually can keep that on the shelf for quite a while. Now, if you need something longer than 45 minutes, then we've got to start rethinking things. It's pretty safe to lay them down under this cocktail in the field for up to about 45 minutes. If we're going to go longer than that, then we need to make other arrangements. We're going to haul them into the clinic and put them on a gas anesthetic. There are some continuous infusion things that we can do intravenously, like triple drips and double drips. But you get into bigger issues with oxygenation and whatnot. And so if we're gonna do something that we can't accomplish in 45 minutes, then we're going to bring them into the clinic and probably put them on gas with that endotracheal tube. Yeah. Well, the halothane we don't really keep around anymore, and so we don't really have access to it. Isoflurane, I really like isoflurane because it's rapid onset, relatively rapid offset, and it's very safe. I'm not a big fan of sevoflurane, and the reason I don't like sevoflurane is it's more expensive, as part of it. The reason I don't like sevoflurane is that it blows off so fast that they wake up too quick. And I see animals thrash sometimes when they're coming out of sevo. And so I like the isoflurane because they get over it quickly, but gradually. It's not like a light switch. That sevoflurane sometimes is like a light switch. And we've had animals careen off of walls because they just leap to their feet, and then they don't have the senses to be able to stabilize themselves, and so they ram into a wall. And so for me, isoflurane is almost exclusively what I use.